Hi, everybody. Good morning, good afternoon, good evening, wherever you are. Thank you for joining this special webinar delivered by the International Academy for Clinical Hematology. As you may have noticed over the last few weeks, we have launched this special series of webinars dedicated to the COVID-19 pandemic. This is really a terrible time for all of us in the medical community, but also it's a very hard, terrible, and challenging times for everybody. And we have some very special thoughts to all those people suffering from this nasty infection. As part of this special series of webinars by the International Academy for Clinical Hematology, we have already addressed several topics, including management of hematologic diseases. We have shared some experience from Italy, and for today, we thought that it may be a good opportunity to share the experience of a dear colleague who actually was a patient of COVID-19, but also was a caregiver. And you will see this experience, I think, will be extremely useful to all of us. So I'm extremely grateful to Dr. Noopur Raj, who is a professor of medicine at Harvard, and she is a very well-known and famous expert in the field of multiple myeloma. And you probably remember her very recent paper on CAR T cells in relapse refractory myeloma, published in the New England Journal of Medicine a few months ago in 2019. But today we will not speak about myeloma, so I'm very grateful, Dr. Raj, that you joined us and you accepted to share this experience with us. And for me, the idea came from a series of tweets you have sent, and this is on the screen, where usually both of us are actually rarely or never share personal information. But here you said in your introduction, I have learned some things. And this is why I thought that that can be extremely useful to our colleagues. So thank you for joining, and please feel free to express whatever advice, feeling to our audience. So my understanding is that experiencing COVID-19, being a physician from a major academic medical center, dealing with very terrible diseases, refractory myeloma after 10 lines or 12 lines of therapy, still, that has been a huge challenge for you and for your family member.
Yeah, no, thank you so much, Mohammed, for having me. And, uh, as you pointed out, none of us shares such personal information on Twitter. But I think part of the reason to do it was there were so many unknowns about this. And for us as physicians who actually take care of critically ill patients, we know how to take care of them. With me taking care of my husband throughout this course, I realized that this is not something which is easy. And for me, it was unimaginable for people who don't have necessarily the access to healthcare that we do, for people who don't have the knowledge base to be able to deal with a disease like this, where even we as physicians are struggling with what the best practice should be. I thought it was really important to just lay it out there and share it with people and hope that people can learn from this. My biggest things were to tell people that you can be, you've called me a patient here. I don't consider myself the patient because I am COVID positive. That's it. It's a test where I'm positive and I haven't experienced any symptoms. Whereas somebody, I mean, both of us live in the same house and have had completely different responses to the same virus. So that is something which is important for people to understand. I think the one very big piece which I wanted to highlight was the fact that as a caregiver, as I was taking care of my husband, realizing that this requires a lot of attention. It requires a lot of involvement. It is not easy when you're doing things wherein you don't really know what the outcome is going to be. Can be extremely difficult and extremely challenging. And I think the few things which I absolutely wanted to highlight was when is it important to ask for help for the caregiver? The second thing is, which I really wanted to address, and I don't know if those tweets have really addressed that, is there's so much of anxiety around taking care of people with COVID because of exposure to yourself. Now, if you're so closely associated, the chances are that you are going to be COVID positive. And not everybody has that same response. I have been fine for the last 4 weeks. I have had no problem. And I don't think we should be fearful of taking care of these patients because I do feel, with that anxiety, we're going to sort of be afraid to take care of people with COVID and we're going to be alienating them even more. So, a lot of things, which is what I learned along the way, and this was just a mechanism of sharing some of those experiences.
Well, I mean, you're really pointing to the huge level of uncertainty we are facing with this totally novel disease. Actually, we keep on discovering every day new symptoms, new signs, new markers. And actually, this is really, I mean, both of you being top physicians, hematologists, and a cardiologist, and still you clearly mention this huge sense of anxiety and about being totally unable to know whether it's going to be better or it's going to worsen, and when one would push on the button, I would say, to seek help and go to the hospital. So, how did this happen for you when you were taking care of your husband and you're watching based on general medical information? I think I believe you've been following, and then you decided maybe it's time to move into the next step because maybe things are worsening.
Yeah, so tough decision, and really there's no good guidance around this, which was again part of the reason to share the story. So the first week was fine. Fevers, high fevers, lots of weight loss, but that's something we're fine with. If you're sick, you're going to take care of it. I knew he was eating, I knew he was drinking, despite the weight loss. But the fevers persisted, and he was extremely weak. He had I believe, close to a 14-pound weight loss. And I was comfortable with all of that because, we take care of pretty sick people. I think what the turning point was around day 9, day 10, when he started developing a cough. And the cough was a very chesty cough. His breathing was okay, but it seemed a little, he was working to breathe, but still his respiratory rates were fine. And that's when I really, even when taking him to the doctor initially or taking him to MGH, what my goal was, hey, I need a little bit of blood work. This is day 10. Things are not getting better. Things may be getting worse. I think some imaging and some blood work. So my sense really was to take him to the hospital, get some, objective markers, and then hopefully be back in a couple of days.
Yeah, but then I mean I agree with you. We are very it's very common for us hematologists to take care of very sick patient, and uh, but here we're talking about someone who was otherwise healthy, which is, I mean, I would say a totally different perspective. Uh, it seems, let's put it between brackets, normal, I would say, if you have a highly immunosuppressed patient undergoing chemotherapy, to have fever, to lose weight, to get weakness. But here we're talking about young, fit, healthy physician who still got such severe symptoms. And I remember in what you wrote that what happened in the hospital when you were looking from the other side, I would say, because obviously you're also familiar with reading CT scans and blood tests, but here you were looking into the results of someone who is very close to you. And how did you handle this?
Yeah, no, I think that was, you're absolutely right. You're looking at it from a patient and a caregiver now. And with the knowledge base we have, we know more. And seeing the uncertainty, seeing the worsening of, even after hospitalization, I think the big things to take away from this, as you pointed out, healthy, otherwise healthy, fit, normal, without any comorbidities. Um, this is a disease which can happen to anybody. None of us is immune from it. That's number one. Number two, watching the labs, watching the x-ray, seeing the CAT scan from the other side with the knowledge base we have can be extremely um, anxiety provoking, and it was because part of it is, when you know what the outcome is, it's easier to deal with. Here there's a bit of an unknown. Even asking my colleagues, what do you think is going to happen, the answer used to be, we've got to wait and watch and see what happens. So I think the biggest challenge is the big unknown. I do think things are going to get better, and as we learn more about this disease, we will know more. But right now, as you pointed out, lots of unanswered questions. For example, seeing the CAT scan, and I've said this, I did not expect it to look the way it did, right? I thought it's going to a little bit maybe on the chest x-ray, CAT scan, but that was what prompted them to put him in the ICU as well. The good news is my husband never needed to be intubated, but they would have should he have tired with his breathing, because they had consented him for intubation. They watched him for 24 hours before they sent him to a COVID floor. So I think a few things which to take away from it is you can get sick really quite quickly. Even on the morning that I was going to transfer him to the hospital, I had driven my car here to drive him. And then, in a question of 2 hours, I ended up calling 911 and the ambulance. So things were evolving, and my take home for most people is, I was monitoring him at home, but if you can do that at day 5, day 7, things not getting better, ask for help, because your healthcare providers are there. There's a lot of anxiety around how overwhelmed we are, how busy we are with taking care of COVID patients. Yes, the answer to that is yes. But the really sick ones are the ones who need to go to the hospital before it can be too late. So that was a really important lesson for me. Even seeing him every day, I did not realize how sick he was, because when I saw all of his inflammatory markers, they were really, really high. And even after hospitalization, they did not get better. They kept getting worse for about 6 or 7 days. So part of us wanting to share this is, the notion of 2 weeks you're going to get better didn't happen. It took 3.5 weeks. His fevers persisted for close to 3 weeks. Inflammatory markers going the wrong way for close to 3 weeks. So everybody's disease is different. I think in general, one can assume that a couple of weeks you're going to get better, but if you're not getting better, seek help. Take people to the hospital. Second thing I think is, don't be afraid to take care. Don't be afraid to be the caregiver, because if you've been exposed for 5, 7 days and if you've done fine, the chances are you are going to do fine. And people need care. They need to be given fluids, they need to be given food. That anxiety around taking care of a patient is also tough. And I think the other biggest message for me is, you can be like me, you can be completely asymptomatic and be COVID positive. So you have to consider yourself a vector, consider yourself a carrier, because you may be the one passing this around. And until and unless we have more uniform testing, until and unless we have some level of surveillance, the immune surveillance, we're not going to be able to answer those questions. So until we have those things in place, what is it we can do to prevent this huge surge? What is it that we can do to prevent people from really getting sick or from you passing this to others? Is one is socially isolating, which people are now taking seriously, and I'm happy that they are, but not everybody is. The second thing is, until we can do full testing, consider yourself somebody who could pass it along, and mask up. You have to mask up. These are simple, simple methods, which is sort of the ABC of infection control. It's not rocket science, and I do think it's really, really important for us to take this seriously. And finally, stay home if you don't have to be at work, because you may be the one passing this along.
So, I mean, these are definitely great advice. And as you said, it's not rocket science, it's basic. And what we're learning from this pandemic, from this crisis, is sometimes we are able to do the most sophisticated therapies, but we simply miss the basics, and we have to rethink on the way doing things. So I think in your comments, and I believe this is very important to the audience, to the colleagues, to the patient, is about this worsening, the aggravation of the disease, of the infection, which can happen around day 10. And I think this is extremely important, and we need to be aware of this. Has been described in the different Chinese series. It has been described in the Italian series. We know it now from series in the US, from Seattle, from New York, from France, from Spain. So, and this is how tricky is this infection, because everything can go well, and then suddenly around day 9, day 10, things can worsen. That's an important point. The other point, which is, and I'd like to get your thoughts on this, is that we are usually taught during our medical school, and I believe it's true in the US and elsewhere, is that as physicians, we should avoid taking care of our families and closest people. But here, in such a situation, I guess there is no choice. And I would like you to expand maybe how did you handle this at home? Because initially I believe you didn't know that yourself you were positive. He was symptomatic. Then you had a high level of suspicion, but then obviously you needed to protect yourself to be able to take care of him. Am I correct?
Yeah, no, absolutely. So he was tested way early because of the high index of suspicion. So I knew he was COVID positive. I did not get tested for about 10 days. But, I was not worried about myself, to be honest. I did take precautions. We socially isolated in the room. I used a mask. I used gloves. I used a lot of Purell. I did not have any eye protective gear. But I did had his door sort of closed as to watch him, as to check his vitals and blood pressure and all. So to me, it didn't cross my mind as to that I should not be taking care of him. It's just a natural instinct that I was just taking care of my husband, and it was the normal thing to do. But that's part of the reason to put it out there. People are afraid to take care of these folks. The other thing, you brought up the issue of being a physician. When you stop being the doctor and when you start being the real caregiver, as soon as my husband went to the hospital, I took a back seat because, I knew he was with my colleagues who were the best in the world. I knew if anything, he was getting the best care possible, and I could sit back. I was obviously concerned because of my understanding of disease and labs, etc., whenever I was to be told about the labs, but I did not, for once, kind of try and make any suggestions or advice for treatment. I was totally the patient and the caregiver at the time. And prior to that, I did take sort of whatever precautions I could at home to prevent sort of infection of myself.
So that brings me. So you were you were sitting like on the other side of the bed, like any caregiver, any family member. And that brings me to all these psychological aspects and all these, I don't know, ideas, whether, that comes during these moments, especially, of course, you said the good news that he didn't need intubation, but still, I mean, you witnessed him that he has been consented for intubation. And if he has been consented, it means, well, it can happen. Otherwise, they wouldn't have done it. From a psychological point of view, how did you handle this, especially that in what you wrote, uh, you said, "Oh, I focused on just basic things around the house." Can you describe this?
Yeah, no, it's really hard, and you cannot underplay this. That night, I've said this in my tweet also. I slept with my phone next to me, and I said, "Hey, the phone call I'm going to get at night is going to be to tell me this." Um, I ended up honestly just hanging around the house, focusing on cooking, listening to music, praying. I prayed a lot. I don't think I've ever prayed as much as I did during these past couple weeks, and it really refocuses your priorities in life. And all I could do was focus on like what's the next thing I can do, and hope for the best, really, and at the same time, sort of mentally prepare yourself for being, you know, for whatever comes your way. Um, my kids arrived. They were both in Boston when they came. Soon, even before he went to the hospital, my son was here when he knew he was sick, staying. We have my in-laws have a house here, and so he never lived here, but he was there, and he was my constant source of support. As soon as he went to the hospital, my daughter, who lived in California, came as well. So the two of them have been incredible. And just talking to them, even to them, I had to be as they used to look at me and say, look at my face and say, "You look worried today, Mom." I said, "No, I'm good, and Dad's going to be good." So I had to keep giving them that reassurance, and I think all of that does take a toll on you, and we got through it, though.
So family support is extremely important. I've heard, I have seen actually a patient who were worried about the reaction of their families because, there is a lot of fear surrounding this infection, which is like a mystery, totally unknown. But it looks like that your family was extremely supportive and things happen naturally. And I believe you encourage people. This is part of the help they need is to gather all kind of support around you.
For sure, absolutely. You can't do this alone. Don't try and do it alone. And seek out help and use all your loved ones to help you through this. And the biggest thing is don't be afraid. I do think going forward, there's a bunch of things we're all going to learn. This has come upon us as, we're in the middle of the eye of the storm. There's a lot of unknowns, but as this is happening, we're learning, right? We're going to have an antibody test soon. We hopefully will start looking at things like viral load. These are sort of basics of infection control. We weren't prepared for this pandemic the way we should have been, but I think we're soon going to quickly learn, because it is possible in the next couple of months we're going to absolutely learn. There are people who are going to have probably a very high viral load, and they're the ones who are going to be the ones who get critically ill, and we can identify who those folks are and have those actually be hospitalized, etc. The majority of us, 4 out of 5 people, are going to be fine. We don't even know what the prevalence of this disease right now is. That's because we are not widely testing. There's got to be a lot of people like myself out there who are positive, and we just don't know. The only reason I'm tested is because of my exposure and because of my need to go back to work with immunocompromised patients. I'm not going to be allowed to go back until I test negative, which I think is the right thing. And going forward, the only place where we can think about getting rid of the social distancing, get rid of things like masking up, the basics, as we pointed out, would be when we have that data. We need the data on the prevalence, we need the data on the viral load, we need the data on your immunity to this. And once we have that, that fear of taking care of people will go away. The us being able to identify who are the ones who need this acute kind of a care, hopefully we will be able to better identify. So I'm very hopeful for the future, but until that happens, I think sharing our stories, learning from each other, and preparing as best as we can to try and deal with this is what we should all be doing right now.
So, what was the reaction of your patient? Did you receive messages, reaction, thoughts, and
It's been
what are you going to tell them when you go back to work soon? I hope.
So I've been very open about this, Mohammed, and the reason I've been open is, I don't want people to, one is worry, and two is, um, you know, it's full disclosure. I've been out there basically because of the kinds of people we take care of. They're at high risk, and the last thing I would ever do is put my patients at risk. I am extremely close to all my patients, and I've had an overwhelming response of support and love and prayers that I've never seen. I never once imagined. Uh, that the tweet I sent out on Sunday would go as viral as it did. I thought people are going to read it, a few are going to learn from it, and the only reason to do it was to serve as a resource for other people who do not have the help. You know this. A lot of us in the healthcare field are families who are both physicians, and we are actually taking care of COVID patients. And I wanted this to be out there for them as well. So all I can say is I've was completely blown away with the reaction to the tweet, number one, which I did not expect, but also a very positive. I haven't had a single tweet back at me, which has been sort of a negative tweet. It's been unbelievable. And what to me was most striking is I've had primary care physicians tweet back at me saying, "Thank you for letting us know so that when our patients call, we are going to take these symptoms seriously." So to me, that is really, um, it kind of reinforces the fact that this was the right thing to do, to tell people, to share the story. And if more of us can do it until we get some of the things that I talked about in place, we're going to basically learn from each other and get the only way we can sort of overcome this is to do this together. And together, we're going to be able to be stronger and be able to address this pandemic.
I mean, this is really fantastic, Noopur, because actually you managed to transform this very horrible, I would say, experience and almost facing the worst outcome. You managed to transform it into a very positive experience and trying to help others, patient, colleagues. What would be your final message to our colleagues, to anybody who's watching this webinar?
Yeah, no, but all I'm going to say is, I have been incredibly grateful for the support, the love that both Jag and I have received. It's been, it's just brought all of us so much closer together. I am extremely hopeful because I do think we're going to get all of those things in place, like the testing, like the immune surveillance, like the antibody testing. But until then, please, please, please consider yourself the carrier. Please take care, because even if you don't care about yourself, care about people around you. Don't spread this. And should people end up having this, because nobody is immune to it, it's happening to young, healthy people. If it happens, don't be afraid of taking care of the people. Take the necessary precautions. The chances of you becoming very sick from it is really quite low, even in the big scheme of things. So don't be afraid, and do not ever be afraid to ask for help.
Well, thank you very much, Dr. Raj. This was really wonderful. It looks like it's a completely different vantage point being on the other side of the bed. And you have nicely and positively shared this experience. And I think you have summarized it all in your conclusion in the tweet where you said, we're all in this together and we'll come out stronger together. I believe this is the best summary one can have about this situation. So I wish you good recovery, very rapid recovery. My best regards and wishes to your husband, to all your family. And once again, I'd like to thank all of you attending this live webinar. As you may guess, we will not take questions because this is such a special and personal experience, and I don't feel that it would be appropriate to take questions. Obviously, Dr. Raj and myself would be more than happy to continue the communication by email. But with this, I'd like to thank you all and wish you a good night, a good day, uh, wherever you are. Thank you very much. And please join us for all the next IACH webinars coming soon. Thank you.
Thank you.